One of the things we get asked a lot is, how do you use this? This is a Caverject, and it's an injection of our prostadil, or prostaglandin E1, which is used for erectile issues. It's relatively straightforward to make up once you know what you're doing, but that is the trouble. Once you know what you're doing, it's easy to make up. I'll try and hold it so that you can get a fair appreciation of how it works. So this is a Caverject. They come in what's called an impulse device, and it's a single-use device. In a box, there's 2 of these pens. So I'll just open this and I'll make it up and show you how it's used. So to start with, you peel the backing off, and in the little tray there's 2 alcohol wipes, a pen, and a 12.7mm BD needle. This is the same needle that diabetics use to inject with. The process to make it up is relatively straightforward. You should always wash your hands before you make up your injection. Infection control is really important, and because we're penetrating the skin, the last thing you want to do is get infection. 2 alcohol wipes. Take one, open it. Now the alcohol wipe is a fabric pad, so you can tear it right through the middle, and that pad then stands out. That way you're not fishing around trying to get the pad out of the little paper sachet it comes in. Take the alcohol swab and clean the port, the attachment point where the needle goes on to the actual syringe. That needs to be cleaned. So you get the alcohol wipe and push it into the end. You'll notice that there's a dark grey part and a light grey part. The light grey part is an aluminium foil or seal. The dark grey bit is a rubber bung. So I've just given that a clean and give it a bit of a wipe around the clear barrel. Make sure it's nice and clean. You then want to take the needle. You'll peel the pink foil off the needle. Inside that now is a needle which goes into the Caverject pen, in via the bunger. So it's really important not to touch this end now because that's sterile. When you put it together, you want to put it together nice and straight. If you put it together on an angle, you run the risk of bending the needle on the inside of this pen, which is the cap, which will then affect it going into the Caverject barrel. So put it on nice and straight, line it up, push it in, and twist in a clockwise direction the white cap. That will then screw up finger tight. So that's now finger tight. You typically leave those caps on until you're ready to inject, but just for the purpose of the video I'll show you. There's an opaque cap, and under the opaque cap there's a protection piece for the syringe which is pink. If you pull that off, you'll expose the needle, which is the 12.7mm length needle. I'm just going to pop that back on because we don't want to prick ourselves. Now that that tip is on, what you'll do is you'll screw the light blue bit into the dark blue bit. Now you've got to remember this is a 20 microgram pen. There's 2 strengths, a 10 and a 20. The 10 it's a light blue, the 20 it's a light blue plunger, the 10 is a white plunger. So you're going to screw the light blue plunger into the dark blue barrel. I'll do that now. What you're going to see is a little disc of medication is going to pop out of the top, a dry crystalline looking disc, and then it's going to fall back into some water for injection. When you do this, it's really important to keep the pen pointed upwards so that the medication doesn't leak out. If you tip it upside down and screw it in, the water will all run down into the end of the syringe, mix with the medication, and it'll come out the end of the needle, which is not what we want. So by keeping it up, as we screw this in, it's going to expel the air out. Here we go. I don't know if you'll be able to see it in the video, but the white disc is coming out, and there's the water, and the white disc of medication's fallen out into that liquid, and it's now mixing. There's some solids in there at the moment, so some non-dissolved medication. That'll take a moment to dissolve. We always want to check that If there's ever any solid particulate left in there, when you hold it up to the light, don't inject it. But do remember that it might take a minute for that to all dissolve. You can give it a bit of an agitation. If you hold that pen upside down now, it won't leak, because we're not pushing or pulling the air and the liquid in it. So you can hold it up, or you can give it a bit of a shake. So that now is nice and clear. At that point, what you do, so that light blue bit is screwed in all the way, it won't screw any further. At that point, you want to stand the syringe up, and you'll push the light blue plunger, or the white plunger, if you're using the 10 microgram pen, you'll push that into the syringe barrel. That'll do two things. One, it will expel the air from the top of that syringe, and two, it will engage the dose counter. Now the dose counter is a little window where there's only one of them on that pen, and that will allow the patient to set the dose. So I'm going to push that up now, and that's expelled all the air out of that pen, and I've pushed it in as hard as I can. I'm pushing that physically as hard as I can, and it won't go in anymore. So you're not going to over push it. So push it in as hard as you can, that'll expel all the air. At that point, you can adjust the dose. So to adjust the dose, we spin the light blue bit, we spin that clockwise, and the numbers will come up in that window. So that's 5, 10, 15, and finally 20. So that's the dose of the medication you're going to be giving. So it's 5, 10, 15 or 20 micrograms of our Prostadil. Your doctor will advise you as to how much you should use both initially, and then how you would titrate that dose, how you would adjust it either up or down depending on the result that you get with that. So let's say, for argument's sake, you've been told to set it to 10. If you happen to go past the number, keep spinning it clockwise, your number will come back up again. So that will continue to turn, and go back through the numbers until you get the right number. Make sure the number's in the middle. At that point, you can remove the cap. And to do the injection, you'll want to make sure that you wipe the penis nice and clean with the second alcohol wipe. Wipe it nice and clean. The injection technique, as described in some of the other videos, is either at 2 or 10. So you want to be coming in as a clock face at 2 or at 10. You never want to come in straight up and down, nor from the sides. If you're coming in from the sides, you run the risk of not getting the injection where it needs to go, and you never want to inject on the underside of that penis. So it's always on the top half, and you want to come in at 10, 10 or 2. Needle goes in full depth. And then good massage to ensure that you move that little tiny dose of the medication right throughout the length of the penis. So if I was doing that, we'd get our alcohol swab, wipe the surface of the penis, make sure it's nice and clean. Again, you want to make sure your hands are clean, so if you haven't washed them, you'd wash them. Retract any foreskin, so if you're circumcised, there might not be a lot of skin accumulating at the head of the penis. If you are not circumcised, you still have a foreskin, you'll have to retract that. Hold the penis behind the glans. The glans is the bit at the end. Hold it nice and tightly, either like this, or you can come over the top with the hand like a duck beak and hold the penis in that way and stretch it. You want to stretch it out straight in front of the body. By stretching it straight out in front, you're a better chance of getting the needle into the right part, into the cavernosal tissue, the part that fills up with blood, which is where we need it to go. So holding the penis nice and firm, stretch it out as tight as possible. You've wiped it nice and clean. You'd withdraw the pink cap. That exposes the needle. You'll have to imagine that penis is stretched. I haven't got enough hands. So the penis is stretched straight out in front, and that needle comes in at the 10 o'clock angle, and it goes in, avoiding little knobbly blood vessels, goes in full depth. Once that needle is in full depth, the patient pushes the light blue plunger into the dark blue, and that medication's administered. Give it a moment, withdraw the needle. That goes in a sharps container. Make sure your pharmacy gets your sharps container. You don't want to go popping them in the bin, they need to go in a proper container to get rid of. And at that point, if there's a spot of blood and hold that tight for 5-10 seconds. Any bleeding would stop. And beyond that, you want to do good firm massage for at least 30 seconds. So massage, like this. You want to do the external penis and what I'd call the internal penis. You need to remember that that's what you can see of the penis, and there's this much penile tissue on the inside of the body as well. So this bit being the external penis, and all that greeny bluey tissue on the inside here is penile tissue as well, cavernosal tissue, and you want to ensure that you massage that too. By doing that, you'll make sure that the drug goes right through the penis, and you should get a good response.